Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course.
Let's talk about sciatica, Brad.
Okay, Bob.
Let's get some relief for people out there.
Right. When you got sciatica, pain from the back, running down that leg, and you want to put the kibosh on it and at least get some relief so that you can get through that pain. So we're not going to talk about a necessarily treatment plan, but
Right.
3 different options that you can oftentimes, and with our experience,
Throughout the day.
yeah,
You can give
you
yourself
should be able
some
to find
relief.
something that works for
Right.
you.
A position.
Right, exactly.
Right.
So should we bring Sam in on the discussion?
Let's go. Sam, you want to come on in?
Oh, yes, I'd be happy to meet Bob and Brad. Okay, here we go.
You just okay his jaw.
Well, we don't worry about that little thing. He's going to keep quiet. So,
Right.
we're sciatica, we're talking almost always the lower 2 vertebrae.
Right. L4, L5, or L5, S1.
Right. And we find out that if you can position the spine in a certain way by going one way or the other, forward or backwards, subtly, or
Right.
even decompression in that where you
Where
pull
you
the spine
pull 'em
apart,
yeah.
you can relieve the pressure on that nerve. The pain will drop down significantly.
Right.
And that is a nice way to manage it throughout the day. So,
Well, a lot of times if you can string a bunch of them together, you'll find out suddenly your pain is gone.
right.
I mean,
That's true as
right.
well. Yeah, you just got to work with it. And we're going to show you
Right.
3, not 3 specific exercises, but 3 different options. We got some subgroups in there. But the 4 minutes on the title, it might take 3.5. Once you get good at that one, it might go down to 2. The first time it might take 4 minutes
Sure.
and 40 seconds.
Sure.
But one way or another, that's just a ballpark figure.
All
So the
right.
first one, shall we start with
Sure.
lying down? Oh, what about our giveaway?
This is our giveaway. I was going to show this by using it
Oh, our
at
Pete's
some point
Choice.
when I was on my side.
Oh, I
Yeah,
see.
see.
Yeah. It's their nice cushion for
Yeah,
multiple uses.
They got multiple uses.
Yep, you can
Right.
stand on it for balance.
There we go.
Okay,
So we're going to start with supine, what
right.
they call
There
it.
you go. So you can lie there in bed, or you could do this on a couch, possibly not too soft.
Right.
The first thing that we're going to talk about is just lying on your back and getting some pillows underneath your legs. Can
Just
you lift
one leg or both legs?
there? Yeah. And you might even want 3, depends how thick your pillows are. And that may be enough just to let that pain settle down.
Yes.
It kind of depends. You may want to shift around a little bit. If you go, I had this work with all people. They say, oh, this is not high enough, and they're able to get
Right.
around, lie down next to a piece of furniture and get your feet up,
Like he's talking about an ottoman or a footstool.
or even a chair if you can,
Right.
if it's sleep, a soft, cushy chair that's in your living room, or
Right.
something of that nature. I've had good success with this position.
Right. And you yourself would often put a cold pack in there
Right,
with this.
right, exactly. So that's always an option, as well as put that, a nice gel one. You don't
Right.
want to get one made out of frozen peas or something of that nature. And you'll just lie there as long as you feel comfortable. You may be there for 5, 10, even 15 minutes.
Right.
And just let things settle down. Then you can get up and move around carefully. Is there anything else?
There's the
in that
leg wedge,
position?
man.
Oh,
Behind
yes.
ya. They actually make a device
Yeah,
that's for this purpose.
yeah.
Now, we don't understand why, but for some reason, it feels better when you have this little slant in here.
Right. It makes that contact against the hamstrings. It just allows you to relax more.
Yep,
You can buy these online. They cost about 30, I don't know, dollars, somewhere in there.
25, 30.
But
yeah.
if one of these other options work, this will probably work even better.
Right.
That's up to you. The other ones are just fine.
You don't have to have so many pillows on your bed then.
Yeah, exactly. Give them back to the kids. All
All
right.
right. Prone?
Well, yes, prone.
Okay.
So
Oh, geez.
be careful, Bob.
Yeah.
So now lying on your stomach with sciatica all by itself can oftentimes relieve the stress in the back and get that leg pain to go away. Now, sometimes you might have to lie down and just lay there for 30 seconds to a minute before you get things to settle out. And then if it doesn't, there's a few little tricks that we're going to show you you can do with here. First of all, you can go back to the pillows, put
Right.
put a pillow or
If it's
two.
too much to lie there without a pillow, try a pillow first
Yes. Yeah.
and put it under your abdomen and see what happens.
Yeah. If it feels better, you could try to. I'm not going to, Bob.
Sure.
We can just talk through that.
You could also, once you progress away from the pillow, you can even try getting up onto a fist.
God damn it.
You can try putting a fist underneath your chin like this, and then you can actually go to two fists if that feels okay. And then the next progression would be actually do the prone prop where you actually get up on your elbow like this.
And you experiment with each of these and find which
Right.
way gets rid of the leg pain and makes things feel better. You want to show them the trick, the roadkill trick from our McKenzie
Sure.
course?
So let's say the pain is on my left side. You can actually try bringing your leg up, and I'm taking my left foot and putting it on my right knee. And you'll find out this, for some reason,
Right there.
we understand why, but this will actually reduce your pain quite often.
Right. And if it does, it'll happen relatively quickly within, 10 to 15
And
seconds.
obviously, if it's to the other side, you'd go like
Yep.
the other side. Like
Exactly.
That. All
And,
right.
if you want to do just a shift with your hips to the right or to the left,
Right.
if it's on your left leg, usually you just slide your hips gently
To the right.
to the right and you wait that 10 to 15 seconds. And, the people will say, oh, yeah, it feels like the pain is coming out of the leg and moving up. That's a really good thing. And then you're going to redo this every hour or so.
So basically, you're turning your body into a banana.
Right.
So
If we could
feet are over that
take
way,
the camera and look
shoulders
down
are
from the
this
top.
way.
Yeah,
Yep.
exactly.
I'm curving.
All right, now finally, this last thing is we talked about the decompression or the
Right.
traction options.
Yep. Exactly.
We're going to show you
There's a lot of different options for
Yep.
that.
the easiest and the cheapest way to do it. It may not. I would say this one.
Oh, Brad, I forgot to mention this one. real
Oh
quickly.
my goodness
So,
gracious! This is
sideline. This is one where you put the painful leg on top, and you actually put a pillow or two or a peach choice pad underneath.
Yeah.
And quite often, this takes away the pain, and it actually will allow you to sleep sometimes.
right. Yeah, if you can't sleep. So here we
Yeah.
got the Pete's Choice. You could use the pillow
Right.
as well. The good old Pete's Choice. I got one of these for my brother and sister-in-law for Christmas because they're working on a house project and they're working on the floorboards and they're on their knees all the time. And
They probably think kindly of you.
yeah, they're grateful.
Yeah.
Yeah. All right. So let's carry on with the decompression or the traction
Sure.
options.
All right. One is you could just use any two regular chairs. And the reason is it's the C-pan that we're worried about. If
Right. We want to have a good solid surface. You'll see. So you'll get down here gently, hands here. Now watch my knees and everything is the right height. Oh, we'll back up. Sorry. That's okay. There we go.
you
Is
see
that
the
better?
knees now?
There. So watch my knees. I'm just going to relax my core so that we get the traction on the low back, push up with my arms, and there we have traction through the back. Now, if you find that you're too short and the chairs are too high, you can put a pillow or something. I'm going to use, this is a really
Peach
good option.
choice.
Just anything to get you up. The idea is that you don't have, you're like, not like this pushing up
Right.
or you're not reaching down here. You get the right height. And that's you have to kind of fiddle with. Depending
Now
on
you
the chair
possibly,
height.
if you have a solid object like a countertop, or if you find a bench that is cemented in, at the park,
Yep.
you could lean on the back like this
Right.
and just lean forward like this.
Yeah,
This
put-
will help take
yeah.
you.
That's what
Stress off of it.
yep, Stuart
McGill.
McGill talks about
Yep.
that one. Yep. Now the other thing that works kind of neat is just if you have a pull-up bar, you have some hanging handles, anything where you can suspend your body weight. But Bob, wouldn't you agree the key thing with this is that you have to do it with a very controlled motion.
Right.
Like I'm going to
And that's why
allow.
it's nice to start with your feet planted on the
Yep.
ground. You can slowly lower you down,
Mm.
and that's going to allow you to relax
Yeah.
and really allow the midsection to relax,
Yeah.
and therefore you can get some traction.
And if things are feeling good, you can experiment a little bit with trying to shift your hips right or left or do a slight rotation. But the only reason you're going to do that if it clearly makes it feel better. It either takes the leg pain away or decreases it. Because you might want to hang and just go to the right if the leg feels clearly better where at that, or just straight. And you'll be there. Your hands will probably tire out before anything, 30 seconds or so.
It's a great thing you could do every hour if you need to.
Sure.
Just give
Yeah,
yourself a little relief.
exactly.
So the final,
The option is, the old inversion table. I shouldn't say old. They've been around for a while, but they can work really good. The bad part about it is I would not go out and buy one if you've never used one. I mean, you could, but if it doesn't work,
it would behoove you to
yeah.
maybe go to a neighbor, somebody who has one, and try one once.
I had one for a
This
couple
is the
years.
Teeter, by the way, very good product.
Yeah, the teeter is built very well, but I've had a number of patients who just swear by their inversion table. It worked good for me with
For
my,
a couple of years, right?
yeah, with my spondy. Things started to settle down. I didn't need it anymore, and I sold it used. But here we go. And now I typically never advise anybody to go into a full inversion. I think about like here is good enough. But I know some people who
Go straight up and
Yeah,
down, which is really
and I could go there. I always figure, if you got enough here, which I've always had enough, and the people I've worked with, be conservative. And if you haven't done one of these, do not. I would never go
start off
full
very
inversion.
slow and yeah,
Don't hang too long.
yeah, let's probably start with just a minute or two.
Right. If you've got eye problems, you're not going to use it.
High
If you got blood pressure problems, you're
yeah.
not going to use it. You really should consult your doctor and make sure that you don't have anything wrong with you. For a completely healthy person, you're probably
And the
fine.
interesting fact, this is called a teeter because looks like a teeter totter, right?
Yeah, teeter.
But the guy who invented it, his name is Teeter.
I really wonder if
I
he
know.
changed his name after he's invented this thing.
I don't know.
He didn't. I don't think he invented the whole system, but
Right,
whatever.
right.
Well, he's got a sense of humor, we think.
But well,
He doesn't
we'll
mind
see.
if we say that.
All right. Remember, Brad, I can fix about anything.
Except for a broken
broken
heart.
heart.
There you go. Be careful.